What providers or home health agencies can give to discharge planners? One of the biggest questions that I get when I go out there consulting is this: what can we give discharge planners? Discharge planners, case managers, and social workers, they're all the same pretty much. They almost all do the same work pretty much. Now, they certainly cannot accept cash payments from providers in exchange for referrals of patients. Okay? What about non-cash items that have a relative low value and that providers who receive referrals are not obligated to provide to case managers? Can case managers accept such items? One of the key areas that we need to consider to be able to answer these questions involves a federal statute that prohibits illegal remuneration or kickbacks and rebates in the Medicare and Medicaid area, and at the same time other federal and state health care programs. This federal statute makes it a crime for any provider to offer or to give or to actually give anyone, in order to be able to induce referrals. Okay? Providers that are not Medicare certified or not participating in the Medicare program, such as so-called private duty home care agencies, may be tempted to ignore this statute. Don't be, okay? Providers, you must remember that the fraud and abuse prohibition also applies to companies that participate in the Medicaid programs. Include Medicaid waiver programs as well as any other federal and state health care programs. To add to this, even if those providers who want referrals do not accept payments from any federal or state health care programs, the case managers, those discharge planners, those social workers who does make the referrals, they need to comply with fraud and abuse prohibition, and providers should assist them in doing so. You don't want to cause people that are referring patients to you to commit fraud. That is your job. It's your obligation. You would want anyone to make you commit a fraud without you knowing it, right? So we need to do the same thing with them and educate them and help them learn these things. The case managers, the social workers, the discharge planners that are actually that have violated the federal statute may be guilty of criminal conduct and may or might go to jail or may be forced to pay large amounts in the form of fines or civil monetary penalties. They can actually be excluded from participating in the Medicare and Medicaid programs. If case managers are licensed, they are also facing the chance of losing their license.